call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Bruce, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Jerry Dickens, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Jim Bergen, Minister of Mission Arlington. Tell your mom I said hello. After the invocation, please remain standing for the pledges.
Let's pray. Heavenly Father, the pace seems so fast these days, and morning turns to evening quickly. Thank you for this chance just to stop and pause and to remember who you are and to thank you for what you've done. I especially thank you for this court, for each commissioner, and pray for each of them for strength and wisdom and for guidance as they do their work today for the people. In your name I pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Good morning, sir.
Good morning. There's one announcement as it relates to the agenda this morning. That is an announcement as it relates to purchasing item 8F1. This is bid number 2021-111. It's the sale of recycled paper. You have a revised court communication in your folder. And also, we are going to, as we have done in the past, we're going to take several things out of order this morning. Once we get to the administrator's section, we're going to jump over to the briefing agenda and take the mental health connection on TXT for Tarrant Cares presentation first, and then we'll follow that with presentations concerning the coronavirus. I would like to take an opportunity to introduce someone to you this morning. Our new Director of Community Development, James McClinton. James is a graduate of Kansas University or University of Kansas, depending on which way you want to say it. He is
Jayhawks.
Yeah. Anyway, James comes from us from Dallas, did some work in Dallas and some other work. He is also the ex-mayor of Topeka, Kansas.
Yes.
And Topeka, Kansas has a strong mayor form of government, so he was their municipal executive also. And he was also the city manager for a short period of time in Italy, Texas. And so we want to welcome him. I think that we made an excellent choice, and we look forward to him being part of our team.
Welcome aboard.
Welcome to the bright side of the Trinity River.
Did you get to smell pancakes all day, too?
I've heard that.
Court members, you have before you the minutes of the regular meeting of May the 25th and the special called meeting of May the 27th.
Move for approval.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Today, again, is the first Tuesday of the month, and this is the last first Tuesday that we're not going to have employee recognition. So I just think that next month we'll be ready to get back at it, and then I've got to figure out how I'm going to recover for the last 14 months, 15 months, where we didn't have everyone here, so more to come from that standpoint. But with that, take it away, Lonnie. Good morning. Because of the COVID-19 virus, we have, and the restrictions that it's placed upon our meetings, I'm sorry to say that we're going to have to postpone our employee recognition. That is one of my favorite times of the month, and so I'm sorry that we're not going to be able to do that this month, but I promise you that when everything gets back to normal or whatever our new normal is, we'll begin those again, and we'll make up for those meetings and for those months that we've had to miss. Again, I want to thank you personally for what you do for Tarrant County, especially during this time when we've had to face the challenges of the COVID-19 virus. Our employees have always stood up for the test, and you've done exactly the same thing during this time frame. You're what makes Tarrant County such a great place to live, to work, and to raise our family. Again, thank you very much, and I look forward to getting back to our routine of being able to recognize our valued employees on that first Tuesday of every month. Thank you. And here are the names of those folks. See the 25-year. Total of 580 years. So next month, we're going to get back at it, and we'll figure exactly how we're going to make up. So I would move that we receive and file the employee recognition.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. I would also just like to announce and remind everyone that we're having our Senior Synergy event on July the 1st. That'll be coming up in a few weeks, and it's a Thursday, and Catherine and really everyone in our office is working hard to get that ready and get that up for the big event. We're going to have a whole lot of stuff going on, including vaccinations. So put that on your calendar. Tell anybody that you would like. If you need posters, I'll bet we have some. And again, we're hoping to have a big event again this year. And that again will be on July the 1st, Thursday, July the 1st. Any other announcements?
Yeah, I would just like to add a reminder that today is the last day of early vote for the municipal runoff elections, and of course, election day is on this Saturday. So if you have not voted, please make sure that your voice is heard in these local elections. Thank you.
Ditto.
And shortly, I'm sure we're going to have a wrap up by Russell. I see Russell's back with us, so the legislature has now sine died, so everybody can sleep a little bit safer now, recognizing that they're no longer down there taking care of us.
Amen.
In many different ways. So any other announcements? With that, you have before you the consent agenda.
Move for approval.
Second.
We have motion and second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Mr. Manius?
Thank you, Your Honor. Before we go into the briefing items, just a quick note. This is something somewhat unusual for today, or in our last, year and a half. We do not have any audience participation forms today. So, and with that, thank you, Commissioner Johnson.
It probably, I would guess probably since March the 3rd, since whatever that March, this is the first time we've not had one.
I can't remember that we,
There was never one that I can, yeah.
So anyway.
Moving right
Absolutely.
along.
Yes,
Quickly.
let's do that.
So yes, so now we're going to go to our briefing items, and we're going to take item 11C, which is a presentation by the Mental Health Connection on text for Tarrant Cares. Ms. Rose is going to introduce the speaker.
Good morning, everybody.
Hi, Natalie.
I'm your speaker.
I know.
Natalie Rose with Judge Whitley's office, and with me for moral support is Virginia Hawk with the Mental Health Connection. I am really very pleased to let you guys know and just kind of go over what we have been doing with Tarrant Cares. So we're the first in the country with Trilogy to roll out a texting platform, Text for Tarrant Cares. Tarrant Cares has been a very valuable resource for the community, where they can go in and they can find information related to children and families, domestic violence, community corrections, veteran services and their families, prenatal age to 5, ex-offender reentry, intellectual and developmental disabilities, mental health and behavioral health, public health and healthy communities, and seniors and adults with disabilities. It's a lot of information. And I think we're probably one of the only ones that have all of these modules in our network of care at this point. So before I really get started into the text, I wanted to give you a little bit more background on how we came about with Tarrant Cares. So we partnered, Judge Whitley heard a presentation at a NACO conference years ago, 10 years ago, maybe 11, that Trilogy, they're a company out of California, put on. Then what they were doing is bringing together all the resources, having one place, a comprehensive list of resources for citizens in the county to be able to go to find any assistance that they need. One of the greatest things about this is that it's available in 108 different languages. So they have the option to go in there and select what language. If it pops up in English, but then if they need to select Spanish, and they can select Spanish, or there's Zulu, Somalian, Russian, etc. And not only finding information pertaining to those specific areas, it's interactive. The website's very interactive, so they can actually enter a zip code and what they're looking for just in general, or they can select from a list to find a specific topic. And the topics also include the latest news and services for that topic and legislative information. They can create a personal health record for themselves, which is password protected. Nobody gets into it but them. And so then unless they share their information with the doctor's office, and the doctor can pull that up or whatever. But that's a really important piece for people that really don't have a place to keep up with their medications, their doctors, their conditions, or anything that they have going on. So we have many partners that help us maintain this website. Mental Health Connection, of course, this falls under their umbrella. And the other resources there on the screen provide annual support maintenance for the website. So between, give you a little statistic here. Between January 1st and December 31st of last year, over 1.5 million people visited the website with 3.2 million different page views. So they went in and actually looked for resources. For 2020, that's a slight decrease, but in most areas we saw large increases. For example, intellectual and developmental disabilities saw a 30% increase. Seniors and adults with disabilities, 27%. The biggest one was mental and behavioral health with an 82% increase in page views. So why are we going to do texting? So texting is it's about being easy to use. Of course, the website's available 24 hours, so is the texting. It bridges a gap, a technology gap for a lot of people. Most people have a smartphone. Some people don't have computer access. It will, if they don't have a Wi-Fi connection, their phone usually has data on it, so they can look up information there. There's no fear of judgment or shame, and they can it's kind of private, and they can be their own navigator and their own advocate. So requests are confidential. Any requests, we don't keep any information that anybody looks for, including with the texting. The only thing we're going to track is just zip codes, and I'll show you how we get to that here in just a moment. 211 is the the data resource for Tarrant Cares. So all of the information is uploaded from 211 on a regular basis. So, and if there's any changes or somebody sees something, then we work with 211 to get it corrected in both places so that all of the information is the same for everybody. And if they don't find what they're looking for, they have trouble, that they always have a little thing that says contact 211 if you need some help. So a little bit about the background of the Text for Tarrant Cares. In 2017, the ACEs task force, they formed that task force with Cook Children's Hospital. They started meeting with stakeholders in 2018 and had listening sessions to develop strategies. So then part of that came this texting idea. In 2019, they had circles of support of one of their strategies, and during one of their circles of support meetings in the Stop 6 area, they said, well, we'd like to text. We'd like to be able to text and find things. So that's where it was kind of born. So then in 2020, we began building out the program and got our partners. We hired a marketing group and PR support for that initial part of it. And then we conducted beta testing, and we actually had to apply for a short code application, is what took so long to get it up and running. So I have to mention the project partners, Mental Health Connection, of course, Tarrant County, Tarrant Cares, and Cook Children's Hospital. Cook Children's had a very large part in helping to put this together and make sure that the information was correct. Also, Loretta Burns with AB Christian Learning Center helped with that input. A total of 84 beta tests and surveys were completed during September. We took a month to test it. 61 surveys were completed, and then we had 23 surveys by local professionals that was also completed. And family surveys indicated that 97% of them found the system to be helpful, and 80% said they would use it again. So how does it work? So from any cell phone, you text the word FIND to 67629, and then it'll prompt you, and it'll say if this is an emergency to call 911. This is not meant for serious emergency and trying to get a hold of emergency services. But it will tell them that and ask them, do you want this in English or Spanish? From there, then it'll run them through the guided search, similar to what is on the website. So it'll ask them what they're looking for, and then it'll ask them what their zip code is. And then from there, they're provided resources that are specific to their zip code, but it also provides resources out. So it starts with their zip code and goes out further. The resources that we targeted for the script, I guess, for when they text whatever they want to look for, we took from a report done by United Way and 211 on what their most calls were about. Most of them were food, clothing, and housing, household services, and mental health and counseling services, all the way down to job search. And we added a link last year for COVID information and resources, and that was also one of those that people called 211 and said, hey, I need to find out some information. So we launched this actually on April 28th of this year. Our media relations included news releases, so we had a story in the Star Telegram. Deborah Ferguson did a piece on the news, and NBC5 is going to put that on their community page as well. And KRLD did an interview as well with Commissioner Whitley. Plus, I would like to take this time to actually thank commissioners for putting it out on social media, because that's kind of what we're doing, is trying to get it out there, and so the public will use it some more. Then the partner support, we're really leveraging that support to reach out to MHC members, and then they then can go to their clients, and Cook Children's as well to their client base. Through Tarrant County, through our municipalities, our nonprofits and our community groups, and then the circles of support with Cook Children's Hospital. Our marketing and advertising, we're starting with distributing it to at-risk neighborhoods. So we're using a form of flyers at vaccine sites. These are things that were kind of talked about, and we kind of tried to strategically go through this, but we talked about flyers and at food distribution and clinics and vaccine sites, and then some outdoor advertising. So we have partnered with J.O. Company, and a couple of the things that we have going are some signs inside the buses and then some bus benches. So we're going to have, let's see, number of benches here. So there'll be benches in English and in Spanish. So the zip codes that the English benches will be in 76102, 104, 105, 112, and 119. And then the Spanish will be in 106, 110, and 115. Then the bus, things inside the buses will be on 65 buses. So it'll be all over the county. So in addition to that, we're going to have door hangers that are going to be distributed in the neighborhoods. We'll have 10,000 door hangers distributed to 76106 and 76110. And then that's on June 21st. And then June 28th, another 10,000 to the 76104 and 76105 neighborhoods. We also have spots on Spotify. So they're audio spots on Spotify in English and in Spanish. They're going to begin on the 21st of June and go through July 31st. So what we're looking at is 230 to 240 impressions. So that'll reach about 80 to 90,000 people is what the goal is. And that means that one person may get it 2 to 3 times, may hear it 2 to 3 times when they're using Spotify. So we're also going to have some business cards, business size cards. It was not financially prudent to redo all these rack cards. We have thousands and thousands of rack cards for Tarrant Cares. So our idea is to attach these to those existing cards. And once those are depleted, then we'll keep these business size cards because it's easy for someone to reach in their pocket and grab it. But we'll also redesign our rack cards at that point. And I have to say that none of this would be possible. I had applied for a Facebook community grant, was not awarded the Facebook community grant, but Facebook reached out to one of their partners, DPR Construction, who wanted to help us with the marketing and donated $25,000 to do this marketing. So we were very, very pleased to have that partner. And on the door hanger, you'll notice at the bottom, it says, "It happens, but it doesn't have to define us," in Recognize and Rise. That is a campaign, an initiative through Mental Health Connection to bring awareness of the impact of adversity, of stress and trauma on our mental and emotional well-being, our bodies, and in our relationships, work and personal relationships. Once we recognize that and we teach the community how to recognize that, then they can rise above it. So recognizing it and then rise above it, and then just building resiliency individually and as a community as a whole. So it happens, life doesn't have to define us. So it just basically, life can hurt. There's things that happen. There's the big hurts and little hurts. And it's just making sure people know what those are. So how can you help? Share this information with your family, friends, and within your communities. Once we have our promotional materials printed, I will make sure that your offices have those for the texting, those business-sized cards for the texting. Commissioner Johnson, or Commissioner Brooks and Commissioner Allen have posted this on their social media pages, which is, thank you very much. And I believe, Judge, you did too. But just share it. Churches, schools, just community leaders, etc. And then follow Tarrant Cares on Facebook, Twitter, and Instagram. Also, the Recognize and Rise initiative, they have a website that has this information and many more things that go on in the county that they're going to have. So that website is recognizeandrise.org. So if you have any questions, I'll be glad to answer any questions, but we're very excited about this opportunity to do this. Trilogy, once again, we asked them, hey, do you have a texting program? They said, no, but let's do it. So they just anything we come up with, they're just right on the spot. So they've been a big, big partner in this.
We've got a great partnership with them. From the very beginning, when they agreed to go from Network of Care to Tarrant Cares, the reentry module, when we suggested that to them, they were very agreeable to creating that particular module. And again, as Natalie indicated, we've been kind of the example across the country as far as how this has worked. And we really want to thank many of the hospitals, in fact, just about all the hospitals in this county have helped and have participated in this. And it's been a great program that's gone on now for many years. And
10, 11 years now.
yeah.
So, and we've actually been visited by other counties in California, Washington, and all across the country looking at our model, not just the Tarrant Cares model, but our mental health connection model as well. Of course, our model doesn't fit everyone, but they kind of come and see what we do. So that's been great. And this year, the Panhandle Behavioral Health Alliance in the Panhandle of Texas, 26 counties, implemented Network of Care for their comprehensive resource for mental health. So, and then the entire state of Oklahoma is also using it for that purpose as well. So it's really kind of catching on. It's really, really, really valuable.
Well, I'd just like to say that Tarrant County was an early adopter of the Network of Care model, and it would not have happened without the leadership of Judge Whitley. So I want to thank you, Glenn, and congratulate you for where it has come to since the beginning.
It's been a team effort. Everybody on the court has been very supportive of this. And we've been, I think, very fortunate. And the mental health connection from the very beginning has been kind of the anchor to help move this along, first through Patsy and now with Virginia. And nobody organized it the way Patsy chose to do it in Tarrant County, and I truly believe that that's what made it the success that it is today.
Yeah, the mental health connection has been a big part. The members have been a big part, big supporters of it. So, and over the years, making sure the information is correct, making sure we have, what they're hearing from their people and such. So that's what's made it become what it is today. So very, very excited and very proud of it.
Thank you.
Thank you.
Good job,
you, Natalie.
Matt.
Members of the court, we can now go to the administrator section. We're going to begin with item 8A1. Ms. South is here to address the court at this time.
Good morning.
Good
morning.
Good morning.
I will be brief this morning, and we'll start right into the vaccination center update. So the Sundance Square location that opened last Friday on the 28th, that site administered 52 vaccine doses last Friday, and will continue to run every Friday for the next 6 weeks from 11 a.m. to 6 p.m. So thank you, Commissioner Brooks, for being there and getting that kicked off. UNT Health Science Center, although not here today, they are slated to open their next vaccination location at Asia Times Square. That should open in the next couple of weeks. And they're working also on 2 pop-up locations at St. Matthew's and Cornerstone Church. So next week when they're here, I expect them to discuss more location details, times, dates, etc.
And just a reminder, if they can actually provide some numbers.
Okay.
We talked about that, I think, last week.
Okay.
Thank you.
Yes, we do.
Last, just a reminder that the Tim Curry site will be moving to Thursdays only for the next 3 weeks before we shut that site down. And then I want to talk briefly about the call center. So the slide speaks for itself, but you can see that the calls have declined 80% over the last 5 weeks. And we only received about 3,400 calls the last week that this data had been reported. So the Group O contract ends at the end of July, and staff has started discussions with public health about bringing that call center operations back in-house once that contract terminates. I think it ends on July 31st. So we'll keep you all updated on the status of that. And then lastly, I just wanted you all to know that I know we've been discussing work sessions to discuss strategy and planning for the ARPA funds. So staff has been working on a schedule for that. So probably in the next few weeks, you will see that on an agenda. Ms. McMillan has more information on that if you also desire to hear that right now, but we are going to schedule that in the next few weeks.
I would hope that we reach out to maybe some of the community foundation. Rose Bradshaw is the head of the Community Foundation, North Texas. I mentioned something about this also to Pete Guerin, who's with the Sid Richards Center. He thought Rose might be an excellent place to start, just to get an idea of what other needs surveys have been done. I truly believe that as we, and the court may or may not agree, and certainly I hope they'll chime in, but I believe that this needs to be something more than just our needs assessment, that the cities need to be involved, that social agencies need to be involved, foundations need to be involved, because I think we have maybe a once in a lifetime opportunity to set some direction with the dollars that we've been given responsibility over. And I think we can partner with a lot of the other, not just entities, governmental entities, like the schools in the cities in the county, but also with a lot of the social service agencies, as well as the businesses, for that matter. So we've got to move with haste. We don't have a tremendous amount of time. We have to have it obligated by December 31st of 2024. If it's a building, we have to have it constructed and completed by, I understand, December 31st, 2026. So we really need to look at this and try to develop a plan pretty quickly.
And I believe Ms. Camerino, along with Lisa and several others in our office, are doing just that. So
Is
we're
that
on
the
top of it.
survey work?
Excuse me?
The survey work?
Lisa?
Yeah,
You know
so,
about that?
so what we're doing now, in fact, you gave, on the consent agenda today, you authorized purchasing to go out on an RFP to bring a consultant in to assist. We're going to bring back that scope of that RFP for you all to look at and approve, and that's how we're going to move forward on that particular item. But a lot of the things that you all have discussed here, we have been discussing that also, and are trying to blend it all into one particular activity. Obviously, it's going to be looking internally and also looking externally, but I think we're on the right path on that thing.
I would like for us to have at least some open discussions here, or however, in a work session or whatever, with those other agencies before we contract with someone to do something.
Okay. Yeah, we were talking about a series of work sessions. So the first work session is just to go over some of the scope on that, but we'll bring some of these other agencies in to talk also.
Yeah, and I would add, if we are bringing in agencies, that they not be Fort Worth like hyper-focused, right? We have a big
Right.
county, and obviously we had so many partners with the CRF dollars. Want to make sure that we're thinking as globally as possible.
So you all could, if you have several other community partners that you think we might want to consider to bring in, if you all will simply send them. Ms. Camerino is not with us today, but if you can send them, Megan, you want to take that information?
Sure, I'll forward them on to Lisa and
Okay,
Kristen.
well, send them to Lisa then, and then we'll make sure that they're also included.
Great.
Thank you.
So, members of the court, we can now go to the briefing agenda one more time and ask Mr. Tenaja to come forward and talk about current health issues.
Good morning, Your Honor, and members of the court.
Morning, Vinny.
Good morning.
Morning, Benny.
Back here again with some developing good news overall. Cases are declining. We're at about 260,000, so there's a real slowdown in cases. 3,508 deaths for Tarrant County. The hospitalization trend is back, starting to go down again, so that's great news developing. We had gone down significantly, then plateaued for 2 or 3 weeks, actually went up, and now we're in a downward trend again. We are with 91 confirmed cases of COVID in the hospital setting. I think this has been a record low since the start of when the surge is starting to happen. So we're at 2.25% hospitalization with COVID. 27 people in the ICU, that's about 8%. And 66 ICU beds available in the county, which is plenty for Tarrant County. And then Trauma Service Area E, we're doing okay. We talked about the Kaufman and Navarro counties and their, minor number changes causing big percentage jumps. But overall, the Trauma Service Area is in a good shape. 334 confirmed cases in the hospital. That's 2.21%. And then 232 ICU beds available.
That Kaufman County
I know.
situation looks like it's getting worse.
Yes,
rather
they're
than
above their
better.
15% mark, but, they can't do anything because the governor's order was that the Trauma Service Area E must be above 15%. So that's the clarification there. But yeah, it does look onerous, but we did talk to the region. It's just that their hospital capacity is so limited that any minor bumps along the way make it look worse than it is.
Okay.
First Monday is yesterday? No, next weekend?
I'm sorry?
In Canton, in Kaufman County?
It is.
So first Monday is gonna be, next weekend. So it ain't gonna get, it's probably not gonna do anything to get redder.
And then the trends continue down everywhere. I mean, all the charts are trending downwards. We're getting close on the case rate also. We're at 35 per 100,000. And if we hit 10 or below, I think below 10, so you got to be like 9 or below, then we're going to be at low spread across the community. So got my fingers crossed that we're getting closer. So things are looking pretty good overall. Everything's trending down. And here's the epidemic curve. The talk about flatten the curve, we've not only flattened it, but it's actually going downwards. We're below 1 on the R0, the spread rate in the community, so things are getting better. U.S. trend, significant declines after that little surge that we saw here over about 3-4 weeks ago. Half of the country is vaccinated, so obviously these numbers are looking very good. Global trends, there's always trouble somewhere, right? So as a population, we're not out of the woods. You heard about the outbreaks in India. There was an outbreak in Japan. Japan's on a level 4 travel alert before the Olympics start and all that. Now Malaysia is on a full lockdown for 14 days starting today. As you can see, the numbers peaked very significantly. The problem with all of this is international travel, and a lot of places where people want to go have gone. So there's always the risk of it coming back, right? So all we can do is then be very mindful of the destination where you're going to, and on the return back, be mindful of all the precautions that you need to take. And the best thing you can do before you travel anywhere is make sure you're vaccinated, because then your risk is significantly lower compared to those that are not vaccinated. Worldwide, that's the chart on the right. We're starting to decline. There was a second peak, as you can see. There was a December-January peak, and now there was like a April-May peak. A lot of that was contribution from India, second populous country in the world, huge outbreak, and that those numbers are starting to decline, and as a result, worldwide numbers are starting to decline. On the next slide, I think I took it out. There was too many slides, but I wanted to show that how vaccinations have been really accelerating across the globe, and that is starting to have an impact as well. So the choosing safer activities, that's a message we need to remind everybody. I mean, we just had Memorial Day, and people got together and all those. If you're vaccinated, you're back to normal. If you're not vaccinated, please continue to take precautions and choose wisely. The activities on the left sort of outline an escalation in risk with certain activities. Make sure that people are, following those precautions and being careful. We just can't afford another spike in our cases. Here's our public vaccine clinic schedule. I'll be honest, the numbers are dwindling everywhere, but we need to keep on the good work on getting vaccinations done, because how have we been able to beat back the pandemic? One shot at a time. So we'll take one shot at a time.
Vinny,
Yes, sir.
HEB/ISD 3191 West Pipeline Road.
Yes, sir.
What is that? I don't think of any place along,
It might be their, admin building, or I was wondering the same thing. Which location is that? But it might be either their stadium location or the admin building location. I'll verify that and let you know, because I had that same question last night, but I wasn't going to bother staff on the holiday, so I will get back with you. But it's on Wednesday from 2 to 6 p.m.
What is that, one of those JPS school-based clinics, right there at Raider?
it could be the special, could be right there, you're right.
Yeah.
Keys, right there, Keys Learning Center. Okay. Keys, it's Keys Learning Center.
Okay. So the main point there is that there's a variety of pop-ups happening. We're addressing ISDs, obviously. There's HEB ISD and Everman ISD. And then there's Westdale Hills Apartments in Euless. A lot of variety of different things happening. And public health's not the only one doing pop-up clinics. You all heard City of Fort Worth doing. A variety of partners are doing these pop-up locations. The idea is to fan out into the community and make vaccinations available at convenience. As you can see, the hours are later. The apartment location hours are 3 to 7 p.m. Anybody's welcome to come, but mostly apartment residents are going to come out and get vaccinated. And we're being realistic. Numbers aren't always the greatest. We vaccinate sometimes 10 people, sometimes 50 people. It just depends on how much interest there is. For example, Sundance Square, we started a location last Friday. There were 52 people that came out, got vaccinated. So given the declining interest, I think that was a good showing for that location, and hopefully it will continue.
Especially since it was wet weather.
It was wet weather, and it was storming, yes. Absolutely.
You could just about say that anyway.
So I actually enjoy that because I don't have to worry about West Nile right now. All that rain is keeping activity low. So I'll
Yeah, the
take it.
mosquitoes are drowning.
They're grounded, yes, sir.
There's gotta be a silver lining somewhere.
Somewhere, that's right.
Vinny, do we have any breakdown as far as the later, the opening? Because that's one of the things that we had talked about before, is whether or not by opening later, do we know what kind of vaccines are coming in by hour, and can we identify?
Yes, I will get you the info, but the numbers are lower than what we had hoped. Yes, I mean, adding extra hours or evening hours, does that give convenience? It does. Some people show up, but they're 20 an hour or less on some hours.
Okay.
Yes, sir.
Judge, what we're trying to do is at least run those extended hours through the middle of June so we get a better count.
Yeah.
Yes.
Okay.
So here's the updated dashboard, and again, as a reminder, this comes mostly from DSHS, the data that they provide. 1,370,000 doses administered in Tarrant County. Not everything went to Tarrant County residents. About 83% of that went to Tarrant County residents. And then if you break down between first and a full series, 30% of the county has at least one dose, and about 25% of the county is fully vaccinated. And as you can see, there's a distribution gap, but there are efforts underway, and I'll talk about it here after this slide. As you can see, those lighter blue areas are where some sign-up challenges are there, but there are partners addressing that. So I want to give a major kudos to our city partner, Fort Worth, who's been doing a tremendous effort on door-to-door knocking and talking about vaccine hesitancy. They've got a flyer that we have a photo of on the right, fact versus myth. Y'all have heard the same myths being talked about here. It's gene therapy, they're implanting a microchip, I'm going to go infertile, all of those type of things. They're trying to address by talking to people one-on-one. It's a major, major effort. 32,000 doors have been knocked on so far. About 20 square mile area has been covered. The reason I bring this up is it's a model, it's an example that we all should follow. Other city partners, university partners, nonprofits, public health is even planning to do the same. We got some CDC grant funding, as you know. Part of that is us to hire some health educators, community health workers to do this work. And we'll also be working with different partner entities, subcontracting dollars to do either this kind of work or something similar, a grassroots type of effort to talk about vaccine hesitancy and see what we can gain out of that. It's not a guaranteed solution, but a lot of different places are trying this. And in the end, public health can serve as a coordinating agency about consistency of the message and scientific accuracy. Because if you have 30 different messages floating around, that itself can be confusing. So we'll be happy to provide the facts versus what's being out there as myths. And here's the final slide on the demographics there. Slow improvements, and this is again for clarification, data out of what we've been able to get from DSHS on how much vaccine has been given. So based on that breakdown, we know there are different age groups that we're addressing. The 12 to 15-year-old age group is certainly seeing an increase in percentage, but 1%. So, we'll compared to all the vaccine that's been given out. So we'll make some strides as more age groups open up. And here's the final slide. Overall, about 750,000 doses given through our network of partners, Public Health, Arlington, other contractors and such. So a lot of efforts underway, and I'll be happy to answer any questions on vaccine or the disease outbreak itself.
Thank you.
Thank you.
Thank you.
Thank you, sir.
Members of the court, if we can now go back to the administrator section. I'd like to take up A2. We're requesting that the Commissioners Court approve an exemption from competitive bidding requirements for an agreement for professional services with Treetop Talent Advisors doing business as Heart Search and approve the attached agreement.
Move approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Your Honor.
Okay. Ms. Tidwell?
We have 3 items for the court's consideration this morning. First is to receive and file the Tarrant County financial statements for the period ended February 2021.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Our next item, we're asking the court to receive and file the auditor's report related to the financial and system controls over the county clerk's vital record system. And the response is attached.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the final item is asking the court to receive and file the auditor's report of the review of the financial systems and controls of Justice of the Peace Precinct 8. Also has a response attached.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Ms. Glenn?
Move to receive and file personnel agenda. Good morning, Ms. Glenn.
Second.
We have a motion and a second to receive and file the personnel agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Thank you, Ms. Glenn.
Thank you. I counted 30 steps.
Good. Was that 30 steps coming? 30 steps back? Okay. Vinny, you're back.
So Public Health has just one item for your consideration. We're requesting approval of a contract for services between Tarrant County and Dr. Arthur R. James for the provision of speaking regarding maternal and infant health inequalities to the Health Equity Alliance of Tarrant County.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
I have a question, Vinny. What time is that?
I will ask and let you know.
Okay.
Thank you.
Ms. Melissa?
Good morning.
Good morning.
Good morning.
We have 3 items for your consideration. The first item is an award recommendation for bid number 2021-111 for the sale of recycled paper for 40-plus tons of assorted office paper and 20-plus tons of OCC cardboard for facilities management, awarding to the high bidder Echo Fibers per unit price.
Move approval.
Second. We have a motion and a second. Any discussion?
This was the one that we had the revised court communication.
That's correct.
Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The second item is also an award recommendation for bid number 2021-072 for DNA validation services for the medical examiner's office, awarding Section B only to Bodie Cellmark Forensics in the amount of $99,000. Section A exceeds budget and will not be awarded.
What was that second part? I'm sorry, I didn't hear most.
Section A will not be awarded because it exceeds budget.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the third and last item is also an award recommendation for bid number 2021-098. This is our annual contract for propane fuel with purchase and repair of equipment countywide, awarding to the primary and secondary vendors listed in your court communique per unit price, per hourly rate, and markup for parts.
Move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Are there any appointments today?
I have one, Your Honor.
Yes, sir.
I would like to change an appointment on the Transportation Bond Project Evaluation Committee. I'd like to replace Pat Howell, who's having some health problems, with Dolph Johnson from the city of Saginaw, not related to me.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any other appointments? Okay, you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Mr. Manius, I believe we have one other
We have
briefing
one
item.
additional briefing item. This concerns a report on the 87th regular session, and since we didn't have any audience participation forms today, we asked Mr. Schaffner to fill in for those individuals.
Welcome
3
home,
minutes.
Russell.
Thank you, Commissioner, and I've got 3 minutes.
Well, if you're going to replace all these other people, then you got all the
Can I have
time
a
you want.
string of 3 minutes, sir?
Yeah, you can have a
Yes,
string.
you can, Russell.
And in the meantime, you can walk out and then come back in.
I'm happy to accommodate any way I can.
You have
so.
2 minutes left.
Judge, Commissioners, good morning. I'm glad to see that now that I'm back, Commissioners' Court meetings have gotten a little bit shorter, so thank you.
Never say that.
Okay, so 87th Legislature ended sine die yesterday afternoon. It was, to say the least, a very interesting, unique, never going to happen again type of legislature. And I think that's maybe the best illustration of that is actually by the numbers. Generally, the House and Senate will pass about 1,400 bills, give or take 50 bills. Okay. This time, they passed 1,073 bills for a total passage rate of 15.4%. And I've gone through all the sessions from the 90s on, and from the 90s to now, and no session has hit such a low passage rate number. And if you may be curious as to the dynamics between the two chambers, the House and the Senate, again, the numbers reveal something quite interesting. Only 587 House bills were passed this session. They're generally around 8.5 to 900 bills. But only 587 passed for a passage rate of 12.5%.
0.5?
12.5.
12.5, okay.
The Senate, however, passed about their standard 450 to 475 bills. They passed 486. for a 21.5% passage rate. So whenever the House unexpectedly adjourned on Thursday 2 weeks ago, and everyone was like, what's going on? That's the issue. That particular issue is the low passage rate of House bills. During the last 2 weeks of session, bills started to become Christmas trees, to where you have a standard bill. If a bill had gotten through one chamber but not the other, or gotten stuck on the process, the legislatures will start to throw in various bills, and so that's the process that we're currently going through, is what got stuck on what when, and what exactly did it do to us. Due to COVID restrictions, House and Senate amendments were delayed, and we actually were not able to see Senate amendments until after the adjournment for someone to go and be able to scan them in. So while the Senate was in session, nobody that was not on the floor could see the amendments they were voting on. And that was a true challenge on how do you effectively work with the legislators in the process to know what's actually going up, not to be able to see it until after they had adjourned for the day. So just a few numbers to kind of do it. We do have a presentation for you all. We sent you a memo last night. It should be included in your red folder with a proper letterhead. I'm sorry, I didn't come into the office after I left Austin yesterday to put it on letterhead, but the administrative staff was kind enough to do that for us this morning. Let's see. Oh, this is new.
You haven't been gone that long, Russell.
Well, I don't know. It feels like it, Commissioner.
Yeah,
It's been a very long time. Okay, so several priorities. The Commissioners Court said are your priorities in November. And we support criminal justice and mental health programs, local public health departments, Medicaid ability. We had a number of very significant successes throughout our legislative program, and I'm very proud of that, and I think it goes to show the amount of teamwork and effort that everybody from the Commissioners Court on to various department heads and elected officials, everything that we were able to do this session. And I wanted to stop on major issues of the session and kind of walk you through where we are, where we're headed, because we do have some direction on some of these issues. So elections, Sb7 and Hb6, for the fourth time in Texas history, the House of Representatives broke quorum to kill a bill. And it was done at the very end of the evening after negotiations have failed on the last night that you could pass a bill out of the House, and a bill out of the House, or conference committee report out of the House. And so the so-called elections integrity bill did die. And from then, after that happened, the governor did say that he would be putting this on the special called session, which will be happening in September or October due to redistricting. So Sb7 got a great deal of attention. There are probably 7 or 8 other elections-related bills out there that did pass. This was the one omnibus bill. They also had another omnibus bill, HB 3107, which dealt with more of the intricate processes related to the elections, And it was carried by Rep. Clardy in the House, and so we are still going through that bill. It is expansive. It's 50, 60 pages long. To understand exactly what's going on there. There are also jury service requirements to if an individual is found to not, has to deny jury service summons because they are not a U.S. citizen or can't prove their citizenship. That information is then compiled by the Secretary of State and sent to the AG's office if it's found that that person did vote in an election. So there's that kind of the general construct, which is also in Sb7, information from locals and from DPS coming up to the Secretary of State, who would then forward to the AG. So that's the general development of how those bills and the enforcement would work on those. There's also a bill that specifically does affect Commissioners Court, HB 2283 by Representative King of Parker. This bill restricts the Commissioners Court's ability to accept donations for elections administration, election-related activities. You have a $1,000 cap on the amount of funds that y'all can receive. We did manage to negotiate with the author in the House to carve out an in-kind donation such as a facility, like if a church donated a room, to where you all can accept that type of in-kind donation, as well as in-kind donations related to water to give out for folks in line, or food, snacks, those types of issues. But as far as from a third-party entity or foundation donating a large sum of money to assist with elections administration, even related to advertising, that is now prohibited without express written permission by the Secretary of State and others amongst the executive branches.
But there's nothing that prevents a foundation or anybody like that from just doing the advertising on their own?
Correct.
Okay.
But they cannot give it to the county or the elections board to receive it and then do something with it. They would have to be fully independent.
Have we received those kind of grants in the past?
I believe that we did receive one grant from I cannot remember the foundation's name, but it for some amount of money that we did last session or last election cycle we did.
I can't remember.
Also, a really, really good bill regarding an elections interpreters and defining who can be elections interpreters that came through that will actually expand the pool of people that can help individuals that have language barriers. So that was an excellent bill for that. But again, there are more on elections, and we will be coming back to deal with a large omnibus elections integrity or election security related issues. Disaster authority, no bill passed that affects the Commissioner's Court ability to respond during a disaster. So your control, the control that you had, the judge and then the Commissioner's Court's had, but going into the session is what you have now. Nothing passed. Law enforcement funding, SB 23 and HB 1900. SB 23 passed, which was the Senate's version of, they refer to it as the Back the Blue Act. So for the 5 largest counties, and only the 5 largest counties, the county commissioner's court during a budget cycle cannot reduce certain appropriations for law enforcement funding. There are a number of carve-outs that we worked with the author to explicitly get out, such as compensation for detention officers. That's carved out. We can do one-time expenses that gets carved out. But this, I believe, we will need to be working through this particular issue as we do this budget as well as the next budget. The bill effective date is January 1 of 2022. So we have this budget cycle that we get to work through before this one begins. If the Commissioner's Court does reduce or is found to have reduced, so the process is a complaint, a citizen can lodge a complaint with the Governor's Office, the Criminal Justice Office. If it is found, there's a 3-step process that it has to go through there. But if it is found to be true and the Commissioner's Court does not correct it or take corrective actions, it then goes to the Comptroller's Office, where it's gone for the final determination. And if it gets to the Comptroller's Office, then we lose the unused increment portion of our tax rate. So the 3.5% on the voter approval rate is what we get every year. The amount that we don't use of that, we get to carry over for 3 years. We lose that unused increment number, not the 3.5%. And I do need to specifically say that it is certain law enforcement reductions that we do not then turn around and go out to the voters within 30 days of that approved budget. So it's a very complex bill that has a lot of bureaucratic machinations throughout the process.
And so within the 30 days of the approved rate would put it before the November election in any given year?
Correct, yes, sir. 100%. It is a standalone, independent election. HB 1900 is the version of this for cities, and again, it only affects the top. I believe it's 250,000 population and above, so only a handful of cities. COVID-19 HR policies.
So as you work your way through the analysis of SB 23, would you keep us informed?
Yes, sir, absolutely.
I don't have a clue as to what y'all are talking about.
Well, I do, but and I'm thinking through with our budget process, like literally, I mean, I would have to have that sitting right next to me while we're having our budget discussions in order to make sure that, I mean, which I know there are different checkpoints. We're all going to be paying attention, but it'll.
Well, and I'm glad you mentioned that. Maybe a couple minutes, I'm sorry to belabor this, but this is a very important point. So the FY21 budget that you all approved increased law enforcement funding by $8 million. If we would have approved, depending on how things are interpreted, because it's all in the interpretation of these things, but you all may have had to go out for an election because in Constable Precinct 1, there was a reduction of about $37,000 due to the retirement of a long time, I believe a 35-year veteran chief deputy. And that caused that budget from the 20 to 21 to be reduced. And there is open to interpretation on whether or not constables in certain counties are actually included as a law enforcement agency based on the definition that they gave. But the FY21, again, you all, Commissioners Court, adopted a budget that increased law enforcement funding by $8 million, but because of a good budget, conservative budgeting practice of putting the amount of the funds in for that actual position, the person in that position, it could have triggered an election for $37,000.
That's stupid.
Well, everybody in the legislature was made aware of our particular situation.
And of course, that's an election at our expense.
Yes, ma'am, which would have cost about $1 million.
Yeah.
So the penalty for doing that is if you don't go out for an election. So the penalty is that if we have the ability to generate revenue, which increases by 3.5%. If we increase it by 3%, the penalty is that we lose the 0.5% for that year.
Yes.
For that year.
In the following year, because your unused increment, unused increment becomes zero. So again, the penalty isn't as harsh as what it was originally, which was you lose all your voter, you can't go any of the 3.5% or your unused increment. But it's just something as we walk through this process, we need to be very careful. Working with budget, we identified approximately 100 line items that may have a criminal justice or law enforcement component to them. So we just need to be very mindful as we move forward.
So in the example that you cited,
Yes, sir.
where a long-serving employee who had percolated through the step system or whatever to a very high level, being replaced upon retirement by a new employee at a lower level, we get penalized if we don't pay the newbie the same thing as the old guy?
So it's over the entirety of that budget because it was COVID and because, again, we run lean budgets within the county. We budget conservatively. And so because of that, there wasn't enough room within our budget, within that particular constable's budget. So it showed a decrease, as there were in a number of different fund categories, but that's the one that I think is the most demonstrative of the situation and unintended consequences.
That exact same example is one that I raised over and over since they first started talking about this bill. And we were assured that that kind of thing would be exempt from the calculations. Now that's not true.
Right. At this point, again, it depends on how this thing's going to end up being interpreted. But as for that specific example, no, that is within it.
Lord have mercy.
COVID-19 HR policies. SB 22 is the COVID presumption bill, which for law enforcement and certain first responders, if they contract COVID within 15 days of being at work, they are to be presumed for certain benefits as gotten it on the job. So it expires on September 1, 2023. The bill does. Our HR department has been more or less following practices and best practices, and Tina could always, and if I say something wrong, stand up and correct me, Tina, because HR and I worked very, very closely over this, but HR has more or less been presuming our folks have anyways, and we have only a very few claims that will be subject to the resubmittal provision, but we worked very hard to, A, restrict it just to COVID, because it started off with a communicable disease, which is, oh my goodness, and number two, it has to have been confirmed by a FDA-approved test, and there is a rebuttable provision in it finally. And then HB 2073, this is the quarantine leave bill. This is another bill that we worked for months on. The Commissioners Court will have to develop a policy, and the Commissioners Court is the governing body, so you all will develop this policy to allow for first responders and law enforcement to have quarantine leave that does not dip into their time off, whether they're personal time or sick time or vacation time, for exposure, for possible or known exposure to a quote-unquote communicable disease. There's quite a bit of flexibility in the bill, and we'll be working very closely with Tina and her staff in the admin office and the CDA's office to work through what a policy would need to look like in order to meet the standards of that bill. But it started as being very, very broad. We were able to whittle it down to where at least the governing body would have the authority and the control over the particular policy. Because at one point this bill literally would have allowed a supervisor to say that someone needed to be put up in a hotel and be paid on administrative leave indefinitely.
Does the bill advise when the policy has to be put in place?
I believe the bill goes into effect September 1.
So we'd have to have.
So we will be working this summer on this. Okay. County Clerk Photo ID bill. This is one that our County Clerk, Mary Louise Nicholson, brought to us. We were able to get a pass. Representative Goldman carried it in the House, and Senator Hancock carried it in the Senate. It allows for us the County Clerk's Office, to combat fraud on property-related documents. Currently under statute, if you've got a property-related document, you can hand it in and have it be filed without having to show any type of ID that you are who you are saying that you're supposed to be. It is permissive. It is a may, not a shall. But this is a really a good government bill that we were able to work through, and it is now going to be statewide. Harris County only had the authority. It will now have statewide authority. So
and there still allows like the flexibility if someone doesn't have one particular type of ID, right? So
yes, there's a process that the County Clerk's Office will be able to set policy on exactly how they do it. Cybersecurity training, HB 1118. This one Representative Capriglione carried. So we all just had to complete our cybersecurity training. I hope that everybody has completed your cybersecurity training. If you haven't, Darren May will be calling you because I believe we have to report on June 15th. So this bill expands it to make it more of a necessity and actually puts a trigger in it to where if we do not have compliance with cybersecurity requirements, we are in danger of losing our criminal justice funding. It did allow, working with the author, we managed to get a number of exemptions out of there, including the ability for Commissioner's Court or your designee to create a policy on how to lock out employees, appointed, and elected officials who do not complete cybersecurity training so that we can meet 100% compliance. Opioid settlement, this is 10 days of
What if they never use it in the first place?
So it has to be of an individual who uses the computer 25% or more for their job duties.
That'll eliminate a few.
The opioid settlement, as you are well know, Tarrant County is a party to a lawsuit and has brought litigation regarding opioid manufacturers, distributors, and pharmaceutical companies. Tarrant County has one of the bellwether suits in the Cleveland Federal Court. Within that, there's what's called the Texas term sheet, which is the agreement on how Texas will use the funds as they come down. The legislature was not pleased with certain provisions within that term sheet, and so they wanted to put things in statute the way that they wanted them. So the funds that the counties or local governments will be receiving, that is unchanged by this bill. The Commissioners Court's ability to continue your lawsuit, even if other parties, including the state, does not want to continue the lawsuit, remains unchanged. And there will be a general revenue dedicated account for the state's 15%, and then hospital districts are also getting about 11-12% of the funds will go straight to hospital districts. So this created an opioid council, as per the term sheet, with some different functions that will actually delve out about 70% of the funds from the settlement whenever it does come down. So work closely with our outside attorneys in the CDA's office on this particular bill.
So who makes up the opioid council?
So it has 6 members that come from mega regions under the 1115 waiver region program. So the Fort Worth region, the Dallas region are combined. So we're one, and local governments within, or cities and counties within that mega region can nominate individuals. Like our Commissioners Court can nominate somebody. You have to be academia or a physician, and then the HHSC Executive Commissioner will appoint that person to the council. So that's 6. The Lieutenant Governor, Governor, Speaker, Comptroller, who has a non-voting chair, they appoint other members, and then the hospital districts get 2 appointees that the governor will make.
Okay.
What's the total number on that?
14.
So we
13
need to be
voting,
thinking
1
about that.
So yes,
Yeah.
that's something, and I'm sure we'll be
Yeah.
working through that process as that goes forward.
Thank you.
HB 1869 changes the definition of debt for certificates of obligation. Instead of certificates of obligation being coming out of INS, your debt service fund, they have to come out of M&O, or your maintenance and operation fund, or it's subject to the 3.5%, which more or less we were able to working with authors. There was quite a floor fight over this. We managed to get a number of provisions in that bill exempting out anything from law enforcement vehicles to equipment to facilities and critical infrastructure. It is very broad, the exemptions, and there again, and also refinancing and refunding of bonds is also allowable within that. So we were able to make significant changes to that. A motor vehicle registration and title.
Before you move on.
Yes, ma'am.
So help me understand what was the original intent of that bill?
To restrict the ability of local governments to issue certificates of obligation without going to the voters. And so they were going to penalize us by making us put it in our M&O rate, using our 3.5% instead of the INS. Working with Ms. Burgess and the motor vehicle registration and titling bill, this was a major priority for the car dealers. We got this where it landed finally and passed, is that it is permissive for county tax assessors or collectors to take registrations from out-of-county vehicles. So if you're in Hood County, you can come to Tarrant County and register and title your vehicle here. The funds, other than a processing fee, will go back to the county of origin where the vehicle will be located. It is particularly complicated, but it did get it did pass, and again, it is permissive for the tax assessor.
So if someone registers in a county that does not have a road and bridge fee, but the car is going to be in Tarrant County, then they will be charged whatever the road and bridge fee is?
In Tarrant County.
In Tarrant County.
So yes, so as part of this bill, the DMV has to come up with a very, very large software program that will allow whoever's opting into this program to select the information, because even like if Tarrant County, let's say we decide not to opt in, but Dallas County does opt in, just as a hypothetical, Dallas County can still collect our titles, fees, and registration funds and have to send them to us.
Do they get anything for doing that?
It's a processing fee that the county, that the registration will receive. So in this one's one of those, it's going to be interesting.
It started out, didn't it, that you could register and you did not have to pay the fees.
Correct.
In the county where the automobile was actually going to.
Correct. There would be a lot of folks registering vehicles in non-attainment areas.
Did the bill provide for a timeline of the creation of this system?
So I believe they pushed it off to 2022. I believe it's January 1, 2022 is the effective date. I'll double check on that.
Well, then they didn't
Yeah.
push it off hardly at all, because it's,
At least it's not September 1. But I think they did put it out. But DMV is the one that will be carrying really the load on this thing to be able to implement it properly.
Well, I'm just thinking back to some years, like I forget what the particular issue was, but when I was a staffer, it was something with the DMV that it took, I don't even know how many years to get straight. And so I would just be concerned about how that affects our business if we're reliant upon the state system that doesn't necessarily, I mean, if it didn't have like a critical timeline to be implemented.
It does not have a critical timeline within the bill per se, as far as you had to do this, it'll all be within the agency as they develop it out. But I think this is something that we do need to approach very cautiously, because it is a significant, this could be a significant issue for us, whether it's, not fully being paid the money that we're due, but also moving around, and the auditor and I had some conversations regarding this of how does the money, it's going to be tricky.
Yeah, okay.
Constitutional care, the lobbying bill or anti-lobbying bill, SB10, no bill passed on that particular issue. It died because of a procedural issue on the House floor, and will no word yet on whether it will be placed on a special session hearing, or special session or not, but it's.
I do think we need to, at least between now and when it might, again, emphasize the amount of money that the state spends.
Correct. The $31 million that the state spends on outside contract per year on outside contracts to lobby the federal government, and the $9 million that they spend on association dues to, again, lobby and advocate for various things.
And that doesn't even,
That does not include HHSC. Constitutional carry, we are working through this bill. We will be getting you all an analysis of it on its effect on our ability to limit, or the Commissioner's Court ability to limit firearms within court buildings, within courtrooms, and what the potential effects are. They made some significant changes, not saying that it will allow it, but we need to make sure that we're working properly through those particular changes. It's a very large bill. It's a very complicated issue, and the DA's office is helping us as we work through that issue. Bail reform died on the last night. It had issues going into it anyways. The conference committee report was filed a minute late, and in the House that minute late matters, and so they would have had to actually have gotten 4/5 vote to call it up, and they didn't know if they had the votes. But it died at the last night because of the breaking of quorum, and it will be on the special session special called session in September, October. Continuing education, so good news, Commissioner's Court. You all can continue your CE hours online now and have that count. They don't have to be.
I'm the only one that it matters with right now, so.
Congratulations,
Yes,
Commissioner.
but that's good news.
So that one, as well as county clerks and district clerks, can now take, for their CE training, they can actually take 10 hours then and move it forward to the next year. And then our elections administrator will have to have training now, and they've actually put $1.4 million in the budget to create that training program for elections administrators. No fireworks legislation passed. That is a must. It is all permissive. And we'll get a list of those particular issues of what you all may be petitioned for those particular holidays. And the winter storm Euro response, this is incredibly complex. There were 3 major bills, SB2, SB3, and HB 4492. HB 4492 started off on the Senate at 11:42 p.m. one night, and it started off with a 20-page floor amendment, which is never, it's always complicated. Very, very complicated, and they ended up just adding a whole bunch of amendments to it, and that's how that bill ended up being written. So it's a very complicated bill. We will be hearing more and more about this, but the long story short, it makes a couple $2 billion available for the producer side to deal with certain shortfalls due to ERCOT.
So the producer side, so that means the producers who already had drawn money from the providers, that many went bankrupt, are going to get more money from the state as opposed to some of the providers getting.
And maybe the best way to understand it is within the supply chain of electricity, SB2, SB3, and HB 4492 helps everybody except for the end user, the actual payer,
The consumer,
the consumer.
right.
So there's assistance that was offered through everybody. They are requiring some winterization on certain situations. There is some money for that, ability to do, I believe it's debt obligations for several $billion. So there are items there, but there was nothing for the actual end user consumer was provided.
Anything that prevents the PUC, who they all said kept the emergency ceiling high for, well, it shouldn't have ever been there.
Right, the extra
because
47
they
hours.
generated no additional electricity when they took the rate from what was around $23 to $9,000.
Yes. So, and no, no movement on dropping that
Dropping
cap
that
or
ceiling.
retroactively dropping that cap.
But this isn't a grant, is it? This is a low-interest loan.
Yes, these are loans, but they were to refinance the existing loans that the companies have done.
Well, and I know you said that it was a complicated bill, but was there actually anything done to help the consumer, right? The everyday Texan who ended up with a $10,000, $15,000 electricity bill?
I'll get back with you
Okay.
on that. I know there's a form you can fill out on the PUC website for assistance.
Did you fill that out for our jail who got a $382,000 bill?
There will be a special called session, September or October. The 4 issues that we know will be on there is redistricting, COVID-19 allocations from the feds, bail bond reform, and election security related legislation. Those are the 4 issues that we know will be on the special called session.
So the COVID-19, is that just deals with how the governor is going to allocate the state's money that came from ARPA?
Yes, so from ARPA, the state got $15.8 billion. It is currently sitting in account. It's the ARPA account 369, and that is where that money is sitting. They have allocated a little bit of it throughout the session, but not in a sense of like moving money over. But one of the bills that you all actually has a priority, the bill regarding 911 wireless fees, increasing it. It's currently 50 cents, increasing it up to 75 cents. They decided not to make that increase. Instead, they are going to appropriate funds out of ARPA in order to fund the next gen 911 system. The state is taking a very expansive view on the use of ARPA funds. There will be capital projects. There will be some very interesting usage of these funds as we go through this. So I think as we do work through the interim until this session, I think it's important that we be having conversations with our legislative delegation on what their view on the use of funds and then how we can partner with them, whether it be
Health disparities.
Mental health?
just, all sorts of opportunities that we can partner. Because they're going to be doing theirs in October, and we need to be prepared to work with them to see how we can maximize ours and their funding.
Has the governor actually indicated that he was going to put all 4 of these on the same special call, or that he might special call one?
It's a bit nebulous, but the anticipation is that these 4 will be on the one for redistrict, or the 3 will be added to the redistricting when they have to, absolutely have to, no questions asked, do redistricting in late September, October, period. So the thought is that we'll just roll them all together.
Do they have to do redistricting first?
There is, I'm not advised as to sequencing, Commissioner.
But if he puts it all on there, then they can do it in whatever order they want to. If he
Right. Unless he.
adds it after they've completed one, he adds another, then.
Right. So
Maybe
we'll,
so.
we'll see. We'll have
Have
a.
the Democrats got their rooms in New Mexico and Oklahoma again? Or?
I'm not advised.
Undisclosed location.
If I were the House, I'd pick a whole lot better place than Ardmore next time.
So, and I'll wrap up. You all have this chart in your memo that we sent out, but it's kind of where your priorities were and then what particular item. I do want to highlight a couple items in particular. There's been no change to game room regulation statute. There was one bill, and it died in a House committee. It didn't even really get going. And so there was not an appetite this session to deal with those particular issues, or issues related to game rooms. We will have a new district court, the 485th District Court, which will be the new one, and all three of the judges' items that they came to you asking, we were able to get accomplished this session. They went in the omnibus bill. And then
This 485th District Court, will it be criminal, civil,
Yeah,
or both?
criminal.
Criminal.
And then county court at law, no,
Number
county
6.
criminal court number 6.
Is now a family violence court, or will be a family violence court on January 1, 2023. So to sync it up with the next election cycle, because I believe that judges may not be running again.
Correct.
Wanted to a couple more items highlight that are very, very important and really significant policy changes that the state has done. First off, the state took, and this was a House-driven issue, Representative Tony Rose from Dallas, to expand Medicaid health coverage for women up to 6 months after their delivery date. That was found to be the #1 item on the maternal mortality and infant mortality task force. That was the #1 issue on how to help with that, and they did pass that.
It's 3
It
months.
passed. It's 6 months.
It is 6 months.
Oh, yeah, so it'll go to, I think it's 3 months now, it'll go to 6 months. The House wanted a year.
A year, okay. Yeah.
But the Senate chopped it back to 6 months. But that is a significant win for public health in our state. And also there are, and the bill's one of those that got Christmas tree, but there's a significant change to child health care for Medicaid, or through CHIP. And so about 60,000 more Texas children will now have access to Medicaid, or to CHIP. 60,000 more Texas children will have access to CHIP because of work that Representative Cortez did this session on that particular item. And then we'll finish up with a couple items. SB 41, both Mary Louise Nicholson and Tom Wilder and I worked hard, and it was a very, very complicated bill, but they restructured this session all of the civil court filing fees and processes. And so for the county auditor, for the budget department, and for both the county clerk and district clerk, over the next several months, we're going to have to be doing a wholesale restructuring of fees, funds. It will be a complicated, very complicated process. We did it last session with SB 346 for the criminal side, but this is a big bill, and this will have huge ramifications. It appears that we will have to see an increase in revenue from it, but it's going to take quite a bit of time to implement. So just make everyone aware of that particular item. And then they did pass a transportation HJR 99. This one will be going to the ballot, going to the voters. It allows counties to do a TERS. So you can pledge ad valorem property taxes for a transportation project. But the Senate stuck in a last-minute amendment on it that requires that not have a tolling component, what the revenue is pledged to. So that will be going to the voters.
So the road itself that the TERS goes to can have no tolling component?
No tolling components. Can't be used to finance a tolling component.
How many constitutional amendments are
I don't know yet.
Okay.
I'm sorry, I don't have that number off the top of my head.
No, you're good.
So, and with that, we'll just, again, there was a lot of stuff, but I've already gone on for long enough, but wanted to see if there are any questions, concerns, comments. And we will be working on a final report to the court after the governor's veto period ends on June 20th.
I know that there will be, I'd like for you to go through and try to come up with a list and an amount of state mandated property tax increases.
Yes, sir. We will be working on that in the final report.
Okay. Mary Louise?
Thank you, Russell,
Thank
for
you.
an extraordinarily good job on our behalf.
Yeah.
I just want to take just a few minutes to say Russ did a great job on our 3415. When I first took office, remember we had squatters. They filed in our office and then went and literally sat in a house. And they did a lot of damage. And District Attorney Joe Shannon prosecuted a few people. Well, they've become more inventive. They go out to distressed properties and they come in my office and they're filing quit claim deeds. And then they mow the lawn. They have a lot of taxes due. They plant a sign. People come up, try and pay cash. They pay cash for that property. They're like, it's legit. Go look in the county clerk office. I own that property. Of course, they filed in our office, and these unsuspecting buyers buy the property. And then here come the owners, you know, the people that their parents owned a house. They never paid the back taxes, but neighbors are calling saying, you know, somebody moved into your house. And so the district attorney's office has really started working with us, and they've prosecuted a few people. So thank you for your leadership on that. So it is happening, and it is a huge problem. They are actually coming in and filing. We could not ask for a driver's license. They were literally sending people off the street. A man would pay somebody $100. They'd jump out of the van. We couldn't ask for an ID, and he would just come in and file a document. And he kept coming back, and finally our team started noticing it. So last session, I tried to get an ID pass where we asked, but the association was against it because the smaller county said, Mayor Louise, you don't understand. We have to keep up with database, and we've got to do, and they killed it. So this year I came back with my larger colleagues and said, you know, let's go to the big counties, those 8 or 10 above, and just bracket this. And in the end, ultimately, the legislature said, no, we're going to do it across the entire thing. The association probably caught a little bit of wind of it, but it already had traction with Russ working with everybody. So it is happening. It is a problem, and the district attorney's office is working with us, and we are prosecuting people that are just taking advantage of the disadvantage of pay cash. It's all over the place. People that buy distressed properties out on our courthouse steps have even gotten together and are trying to bring information to us saying they're not legit. They are filing, so we have this entire kind of community doing that. So I just wanted to say, Russ, thank you for everything you did. The DA's office has been very involved, and we are making a difference because a lot of your taxpayers and our citizens are getting taken advantage of, and we just want it to stop. So now we take your ID, and if we see a pattern, then hopefully we're going to prosecute and get that out of our county and wherever they take it, as long as it's not in Tarrant County. So I want to say thank you for Russ and letting him support that, because it was killed last time, but we made it successful this time. Thank you.
Just one quick comment. I do want to thank the court for providing the services of Russell. He was very accessible and usable. On SB 41, as Russell has mentioned, there is some ambiguity in the bill. We tried to get that fixed and were unsuccessful. The DA's office is going to have to assist us in that, and we will have to get probably tax people at their post-legislative conference to even be able to calculate the final effect of whether that's a positive or a negative, just because they simply refuse to define some terms. So that one is still sort of up in the air, but we'll work on it. Thank you.
Thank you all very much.
Also, really, I want to reiterate what everybody else has said. I want to thank you for everything you did. I get nothing but extremely positive comments from your colleagues and your peers there in Austin. And I cannot tell you how much I appreciate the work that you do and the way you do it. So, thank you.
Thank you, Judge.
Thank you. Well, that's all we have at this time.
Okay, before we close, I know over the last couple of weeks, we've got things that we've been mentioning, I just want to kind of see. Last week, I think Marvin mentioned, as we've talked about the bond issue and other buildings and things like that, Marvin mentioned a facilities master plan. Could we get some sort of just a briefing on that?
Sure. And
exactly how we're going to proceed and what the timeline is, because, you know, that's something that I think we'll be looking at as we go into the budget this year. We've talked about the workshops, the mental health diversion center. I know we've asked for a workshop on exactly who's going to operate that and to try to figure that out. I know you're working right now on a real estate location, but if we could go ahead and get that other part on a workshop even before we find a location, I think that's important. And then I know we had a meeting with the financial advisor. When do you think we're going to bring that to the court for?
Probably within 2 to 3 weeks. Because that's something that tends to be more at the latter part of when we begin to call the bond deal. So it's not something we need to do right away. But on the Mental Health Diversion Center, we've identified 4 sites that we are looking at currently on that. And
I think that's important, but I think it's even more important that we figure out who's going to operate this place.
Yeah.
GK, is it possible to put the transportation bond on the agenda as kind of a weekly item in case there's something that comes up?
We can go ahead and put it on a standing item like we did with legislation. We'll just do that.
That's what I would like to see.
Okay.
Well, if we put that on there, instead of putting it on just the transportation, let's put it on there as a bond issue.
That's fine.
Because that way we can talk about multiple things.
That's fine.
From that perspective. And then the needs assessment for ARPA. I mean, I'm assuming that if we put ARPA on there and we call it needs assessment, or we just call it ARPA funds, that we could discuss needs assessment or anything else from that standpoint.
And possible action.
Possible action.
And we have that first item on our section will cover discussions on ARPA because it deals with the coronavirus.
I just think that we've got 3 or 4 things that are really going on that are going to need some pretty immediate attention and may need the workshops for it. But that's just where we are right now. So with that, then we will recess our open meeting, proceed to close to discuss items exempt under Section 551.071, 072, 074. Having returned from our closed session and there being no business to conduct at this time, we stand adjourned.